Hi again everybody, it's Tim with Inspire Movement Physical Therapy. In this video we're going to talk a little bit about listening and what that is as a diagnostic tool in the osteopathic approach. It is a very helpful tool. We get a lot of people who have multiple issues when they come in the door. You know, might have a knee problem, migraines, low back pain, maybe some digestive issues. And all these issues are connected in some way in the body because they're all occupying the same vessel. But how much are they connected? What is the root of the problem, or what are the roots of the problem? Is there a way that we can start by working on some things and then avoid doing double work and be a little bit more efficient in what we're working on? And that's what listening helps us with here. So it's not literal listening with the ears, although we should be doing that. It's a process of putting the hands on the body and being pulled to where the tensions are and where the tensions are the greatest. And that lets us know where we need to start our work. It's a process of letting the body speak to us and in a way trusting the body's inner wisdom. Now we're going to be doing all the same tests that we would do otherwise. If somebody has a tight hip and it's an orthopedic problem, we'll check hip flexibility, we'll check strength, we'll look at all those things, and we'll be rechecking them after we do our treatments, but we're setting all that aside for a minute and we're trusting what we feel with our hands. So let's show you what that looks like. This can be done with two hands. It can be done with one, and you could put the hands on any part of the body, but we'll just show you here on the abdomen with one hand just to kind of keep it simple. The way it works is you take the hand and you just set it down lightly, you engage the tissues, and a pull can be felt, an attraction. The hand can be drawn towards something. So when I put my hand here, I might feel it being drawn this way a little bit, or perhaps upward, or perhaps this way. And I just go with that. I trust it. If I feel it being pulled this way a little bit, I'll pick my hand up, come over, and do the exact same thing. Maybe I feel it's still being pulled a little bit to the side. Something's going on this side of the body that needs my attention. I'll pick it up again, put it all the way over here. Maybe now I'm feeling it pull inward. So now I know the problem is somewhere in here. If I have my hand down here, maybe I'll feel the pull upward. If I'm up here and engage the tissues up here, I'll feel it pull downward. So in this way I can kind of triangulate where the problem is. Right in here is the sigmoid colon, part of the large intestine, and perhaps there's a restriction in the tissues behind that sigmoid colon, but right in front of the nerves that are coming out of the low back, the lumbar spine. Maybe this is causing a pain condition down the leg. But it also, I've also seen restriction down here cause a problem on the opposite side, shoulder. You never know. So the job right now is to find where the restriction is, go in there, and release it. So we're trusting the body here. We're trusting that the body's going to present to us what we need to work on. But it's not a blind trust. This is trust but verify, okay? So when we put our hand down, we always check our work. We want to reassess. If I put my hand down, I shouldn't feel myself getting pulled to that same spot anymore. That should be gone. I might feel it being pulled in a different direction. Maybe I'm getting pulled up to a restriction in the tissues around the lung. Maybe there was an old respiratory infection years ago. It kind of caused a tension there, and the body's just compensated for it in the years since. But now the body's saying, hey, look, this is the next thing we need you to work on. And that's the trust that the body knows what it needs. So that's kind of how it works. It's layers of the onion. You treat where the body took you the first time, reassess, go back, treat at the next spot. But all along, you're rechecking the hip flexibility. You're rechecking strength. You're rechecking movement. And hopefully pain and discomfort. We want to see all those things change. But the diagnostic method is through this listening with the hands and trusting the body's agenda rather than our own. So that's basically how it works. It's a process of assessment and reassessment, and we're monitoring how the person's doing, but we're kind of serving the body and trusting its inner wisdom a little more than we're going by our own agenda. So that's how it works. Thank you for watching, and have an inspired day.